Most of us know that not every child has equal opportunity to succeed. However, what you might not know is that this disadvantage starts before a child is even born.
When a mother experiences poverty while pregnant, their child is more likely to be born low birth weight due to the intergenerational health effects poverty has while the child is in utero. Let's say we have a mother experiencing poverty while pregnant. She might be facing housing insecurity, lack of proper nutrition, a strain on her income, all of which impact her stress and health and therefore impact her baby. One manifestation of all these health impacts is a low birth weight birth. Being born low birth weight is associated with many adverse outcomes later in a child's life, affecting their educational attainment, emotional development, and more. The main harm here is that poverty, in a hereditary way, thwarts the capabilities and limits the opportunities of children born to mothers experiencing poverty from the moment they are born, before they even have the chance to exercise them.
Currently, about 1 in 12, or about 8% of babies in the United States, is born with low birth weight, which is also known as LBW. The rate of LBW births has increased 22% over the past 3 decades, from 6.8% in 1981 to 8.3% in 2021. Significant and persistent disparities in low birth weight exist, with minority populations and poor mothers being at a far greater risk for these poor birth outcomes. A comparison of black to white births depicts a troubling difference in the rates of low birth weight. LBW is recognized as one of the primary factors contributing to racial and ethnic disparities, as the Black LBW rate has been at least twice the corresponding rate for white mothers for decades, according to the United States Department of Health and Human Services. One of the major factors for disparities in low birth weight is access to prenatal care. Mothers receiving inadequate prenatal care compared with mothers receiving adequate prenatal care are at a greater risk of experiencing LBW births, as prenatal care can help identify health risks and steps that are needed to improve a mother's health prior to giving birth. Research has been done that has found Black mothers who did not initiate prenatal care during the first trimester tripled and nearly doubled the corresponding proportions for white and Latinx mothers. Studies have also found that in all racial and ethnic groups, birth outcomes improve with higher education. One study found that women who did not complete high school had a 9% higher probability of having an LBW child than those who did. It is also observed that mothers with less than 8 years of formal education are 1.5 times more likely to have LBW infants.
Poverty is hard to define. However, the relationship between maternal poverty and LBW exists no matter the level of definitional complexity. We'll start with the most simple definition of poverty as income lowness. A study conducted by Janet Curie and Enrico Moretti found that children born to mothers with a low socioeconomic status were 6% more likely to be born with LBW. There's a generational factor here as well. Mothers with LBW were more than 50% more likely to have children with LBW. Low income affects not only the rates of LBW, but also the financial costs of a hospital birth. The financial costs associated with treating preterm labor and delivery are quite high. The average hospital cost for an LBW infant is estimated to be around $27,000 and $76,000 for a very low birth weight infant. This is quite a big difference from the average cost of $3,000 for a normal weight newborn. While low income is a helpful place to start when discussing how poverty is connected with LBW, there are many other ways that a mother's thwarted capabilities might affect her child's birth weight. This capabilities approach is drawn from the work of Martha Nussbaum, building off economist Amartya Sen. Nussbaum proposes that people ought to have the capability to achieve all the basic needs of humanity if they choose. A life without these capabilities might be described as a life experiencing poverty, a deficit of the dignity essential to a flourishing human life. With this approach to poverty, we can imagine that much more about a mother's life than just her income might affect her and her child's ability to flourish. This is empirically backed. For example, as Jonah mentioned, Timothy Gage and a team of researchers found that even a mother's education levels can affect her child's birth weight, with lower education levels correlating with lower birth weight. It's important to note that these relationships themselves are not causal. For example, a child is not born with lower birth weight because there is some biological difference between a mother who went to college and one who did not. Rather, these correlations indicate that the oppression and poverty a mother experiences can affect her children even from the moment of birth. Martha Nussbaum's capabilities approach is also a helpful lens through which we can examine the harms associated with LBW for children and how it truly is a representation of oppression from birth. The first of these capabilities is life. Nussbaum describes the life capability as being able to live to the end of a human life of normal length, or not dying prematurely. LBW directly affects children's access to life. Gage's team found that infant mortality rates were higher for children born with LBW. Jason Boardman and a team of researchers also found that LBW has a significant negative effect on children's developmental outcomes.
Another capability thwarted by maternal poverty is bodily health, which Nussbaum refers to as the ability to have overall good health. A 2020 study found that housing insecurity, one facet of poverty, impacts maternal mental health, correlating with a 21% increase in the probability of depression and a 19% increase in self reported parenting stress. Depression, anxiety, and stress increase the likelihood of having a low weight baby at birth. Therefore, severe housing insecurity during pregnancy was significantly associated with low birth weight and extended NICU stays. This shows how a child's ability to have good health is hindered by intergenerational poverty as soon as they are born. The ability to have senses, imagination, and thought, as cultivated by an adequate education, is also hindered due to the effects of maternal poverty. Being born with low birth weight is correlated with a loss of a tenth of a year of education on average, according to a study by Curry and Moretti. According to a 2015 study, low birth weight children were 2 to 6 times more likely to have poorer school performance in multiple areas, including science, language, and technology, than their peers born at a standard birth weight. The effects of maternal poverty on children in utero, thwarting their capabilities the moment they are born, highlights the intergenerational and cyclical aspect of poverty. Miranda Fricker also brings to our attention another facet of injustice called epistemic injustice, which is the mistreatment of someone as a knower and communicator. We see this injustice playing out in our topic because there are very limited stories or accounts of women who actually experienced poverty while pregnant and how that affected their child. This could be due to stereotypes of impoverished mothers being irresponsible, which causes medical professionals or the media to dismiss their thoughts, or it could be an act of self-silencing, where mothers perceive that they will be blamed for the outcomes of their children, even though they are caused by poverty, so they choose not to speak. Maternal poverty is caused by a variety of external systemic factors, which we will address in our next project.